My presentation was, as you said, on improving safer practices in oncology haematology. So it was looking at two things, which was implementing closed systems to reduce the risk of exposure to cytotoxic therapy to staff, and also the second part of the presentation was implementing an inpatient, or setting up, I should say, a PIC service for inpatients. So the first one about the closed systems came about from meetings with the lead pharmacist for chemotherapy, who had been to meetings external to the trust, and it had come back from there. They'd had a discussion about using the closed systems in both pharmacy and from a nursing point of view for administration of the drugs. It was discussed at, we have chemotherapy committee meetings, which are joined by quite a lot of different disciplines, and it was brought up there and discussed, and it was decided that we need to look at implementing that system for safety. The chemotherapy nurse specialist team and the lead pharmacist have done a lot of reading around it and discussions together about whether we should do it, etc., etc. And then they decided that we should. It was discussed with the consultants and our senior matron. And so I was asked to be involved in setting up the trial, which I met with BD, with Pip from BD, and it went from there really. Excuse me. BD supported all of the staff. They came in, did training and education, and spent time in each unit, in each area, with staff. Sort of showing them how to use the new systems. The trial went really well. Staff were engaged, and sort of a change in practice happened quite quickly, really. We used the day unit and 2 wards, and it went really well and was successful, which has ended up in a change in practice, and we now use them fully, within our unit, which was really good. So that was that part. And then my second part was about setting up a PIC line service for inpatients. We had a very robust service for the outpatients, but because of the nurses' workload, their time, didn't allow them to get onto the inpatient floor. So 2 nurses were trained to place PICs, and it's been ongoing, which is really, really good. I mean, it's part of, it's not our role completely, it's just 1 day a week of our role, but it works really well. We just need to sort of look at the next sort of year or 2 at expanding the service, but it's got a lot of people. Again, we have to do a lot of education and training, and especially with the haematologists who weren't really keen on using PIC lines as first line. They wanted more of a tunnelled line. So it's gone really well. We do a lot of education training with the staff, but all of the staff across the floor can see the benefit. And, we've done a lot of training on vessel health preservation, which we need to keep going, because PICs are not always the right line for that, for patients, but it's about having that discussions with the staff. So it's all, all of both systems, it's been about a lot of communication and education and training with the staff, which has gone really well. And we've been really fortunate that, both, initiatives and changes in practice have gone really, really well. Now, I think for myself, being involved, especially in implementing the closed systems, I think, I suppose I was nervous about being involved in a trial and leading it, and coordinating it from our unit point of view, because I've not done anything like that before. So, but now that I've done it and been involved in it, I would be more confident to go ahead and be involved in any other big changes in practice like that was. So it's good to do something different, and it's good to stretch yourself and do move out and do a little bit more. Because we all do things in our day-to-day work where we're changing things, because that's part of what we do, but I've never been involved in anything like that before, but it was good to do it. But obviously got a lot of support from colleagues and from BD, so it's been really worthwhile.